Okay. So here are some just program reminders for our AmeriCorps Direct Service members. Today is that deadline to update or add any clients that you, new clients that you serve during the month of October. If any of your clients that you have already reported on, if they have been housed, or if services have wrapped up, we just ask that you go back in and you update that housing date and complete the wrap-up form and upload it to that client's section that you have in America Learns. If you report on volunteers, we need your volunteer report emailed to me as well today. If there's anything that's kind of came up or you need to talk to me one-on-one, we can do that. I'll be checking to see if there's anything that we need to go over one-on-one. If there's an issue with reporting or if you have any questions about it, please talk to me. I know during our site visits, that is a high point that we touch on. And if I haven't had the chance yet to meet with you and your supervisor, those will be scheduled throughout this month, and if we need to, early December. So it has been great, and I really enjoy doing site visits. So yeah, I didn't even make a slide about site visits, but I guess I should have, but that's okay. Just make sure that if you need to update your reporting, please do so. If you want to email the forms directly to me, you can, but if you feel comfortable uploading them into America Learns, you can do that. There's a whole playlist on the Homes for All YouTube page that was created for performance measures and how to complete that, with examples where to go in America Learns. So if you watch those trainings and you still have some questions, that's what I'm here for. And we want to make sure we capture, the people that you are serving across the state. This is just also a reminder for our AmeriCorps Direct Service members. We talked about this at PSO. You'll do 3 quarterly reflections, and that first one will be due by December 15th. So I'll have that opened up in your America Learns account by the end of this week. It's very brief, where it's just another, open space for you to talk to us about, successes that you've had so far in your position, something that you really like about your position. If there are any challenges or other feedback that you would like to share with us, this is another great way to do that. And then the goals that you set for yourself at the beginning of your service here, you can update us on any progress towards that if that's not, or if you want to change a goal, or if you have decided that you want to change something, or if you have accomplished that goal, you'll want to talk to us about it. So that's just something that I wanted to bring up while we were all together today. So you'll have about a month to complete that. Again, it's very brief. It won't take up much of your time, and it's just something that is used for internal use. So really, it's just me that's going to be looking at those and talking to you about that. So just wanted to bring that up. If you log into your account and you see, oh, I have a report due, this is what I'm talking about. Okay, so we're switching gears over to our VISTA members. So our members that are doing capacity building, behind the scenes service. So just another reminder, today is the deadline for the quarterly progress report. It's been open since, the beginning of October. And I just want to say thank you, VISTA members, for doing the supplement report that was due at the end of October. So I know we've had 2 reports that you've had to complete kind of back to back, but I promise they are used in 2 different kind of grant updates that we give to VISTA. So I promise we're not just having you do this for the fun of it. Our federal funders do require this, and it is submitted to them. So this progress report is covering, the beginning of your VISTA project up until the end of October. So that's kind of that timeline. If you remember, that started in July, then that would be from July to October. This is something that you should collaborate with your site supervisor on. So please, if you haven't already, talk to them about scheduling some time today so that you can make sure that the data that you are submitting in this report is accurate, and that you guys are on the same page with what information you're reporting on for your VISTA project. Each VISTA report is specifically for your project, so it does have your target performance measures that your organization that you're serving at submitted with their VISTA application. And again, it will close today. If you need some clarifications on anything, have you and your site supervisor reach out to me, and we'll get that cleared up. Hold on, I think there's some. My chat went away. I'm so sorry. Oh, yes. Oh, Caitlin, I'll reach out to you after the call. I'm very sorry about that. If it's not in your America Learns account, I will get that attached to you. So if that's the case, I'll be sure to do that, and I'll give you an extension. I'm very sorry.
That's totally fine. I just wanted to make sure I didn't miss anything. Thank you.
Thank you. Yes, and Adrian's right. We do not require any reporting above and beyond what the feds require. Okay, so we'll move on. We also wanted to bring up and put it back on everybody's radar, because I feel like January is going to be here before we know it. But MLK Day, that is a day of service for all AmeriCorps members, not just Homes for All service members, but all AmeriCorps members across the state and through the U.S. So we will be doing group projects. So you will be split up into service regions. So this week I will be working on getting your groups sent out to you. Typically what that looks like is if you have other AmeriCorps members from our program serving in the city that you are in or close to you. For example, if you Moorhead, we have 2 different partner organizations in Moorhead, so we'll be putting you guys in a small group. So it's not going to be a large group project. You are split up into some small groups. And it is a community-based project, so you guys are going to collaborate together and kind of think about and brainstorm what is a community project, what's something that you are seeing that needs to be done around your town, where you are serving, where you live. So Just some examples in the past, we've had members, make a hot meal and take it out to some local like camps in Louisville. We've had people go to other nonprofit organizations and serve there in a way that organization could benefit if they were helping distribute meals or organize the pantry. Not just solely that, but I'm just thinking of some like different projects that they've done within like another community partner. Let's see, we get together if you are in or close to the Lexington area. Hopefully Lexington is doing their MLK Day March. We'll get together, we'll meet, and we'll hold our Homes for All banner up, and we will march through downtown Lexington. There's typically a program after that. And then if there's another, project that your group will be doing, then, we'll kind of split up and do that. So there are some ideas. I would just kind of check, locally and see if there are some MLK Day projects already happening where you are in the state. Um, so if you hear something, my office phone is ringing and I don't know how to make it stop when I'm sharing my screen. So sorry if you hear that little ding. We just do like to remind members that if you do not participate because you want to serve on site, unfortunately, those hours will not count towards your service. We need to be out in our communities during our project. Obviously, if an emergency were to happen or something like that, we'll talk about that one-on-one. Hold on just a second. Something popped up on my, okay. So I will get your group sent out to you. And last thing I'll say about the MLK Day project, figure out the best way that works for communicating with the other people in your group. If you figure out that like emailing or like chain emails is not the best way, and maybe using like a group, like a group chat, or like Facebook Messenger, or just like texting. There's so many different like phone applications that are out there that can kind of help facilitate just talking with each other. So just really figuring out the best way to talk to each other, since you will be close. And if there's any communication issues, just talk to me. And there will be a brief report that members, or just I should say groups, you'll only submit one like little form to me, and that's because our group project information will be submitted to Serve Kentucky, who does monitor all of our AmeriCorps programs across the state. Another reminder for all members, here are the holidays that are coming up. These are the days that you do not have to serve. These are the holidays that we have for us to take off. So again, if you need to take off days that work for your holidays, just make sure that you talk about that with your site. We want to make sure that everybody has the time off that they need to celebrate the holidays that they celebrate. Your site cannot require you to serve on any of those days. So they cannot require you to serve on or during the Thanksgiving holiday, winter holiday, New Year's Eve, New Year's Day. So if you choose to serve, that's great. You can obviously make that choice for yourself, but your site or your supervisor cannot require you to do so. If you do choose to serve on the holidays that we observe. Just make sure that you are talking with your site and talking with your supervisor so that you can have that alternate day off. Nicholas, if you care, just email me. And so Nicholas says my service side is taking an extended break for Christmas holiday, 12 days. I was told if my service side is off, I'm off as well. Is there any additional info concerning extended time off? I guess I haven't looked on when Christmas actually is, so you guys are way ahead of me on that.
So, Holly, this is Adrian.
Yeah.
One of the things that we're looking at with HHCK is because the 25th does fall on Saturday, it kind of bumping up the two holidays so that the holiday would be the 23rd and the 24th. And then for New Year's Eve and New Year's Day, it would also be the 30th and the 31st.
Okay.
Now, with the members who are taking, if their site is off for an extended period, they're just closed. You all just need to get with Holly and make sure that you're still on track with your hours, because that's the most important thing, and kind of coordinate that. But I hope that helps. I just started looking at it last week myself.
Thanks, Adrian. Yeah, I hadn't even really looked at when, I guess because we're not even to Thanksgiving yet, and I should be a little bit more prepared for that. But yeah, you guys reach out to me individually and we'll talk about it. We'll loop in your supervisor so that, like Adrian said, we want to make sure for our direct service members who have that hourly requirement, we want to look at your hours and see where you're at and make sure that you are staying on track. So we'll have to look at that more individually. But thanks, guys. Holiday time is always a busy time. I think this is the last slide. Yes, it is. So I'm going to stop sharing this and I'm going to pull up Adrian's training. Before I do that, though, does anybody else have any questions at all?
Okay. Well, this is Adrian Bush, and I'm happy to be here with you virtually. And we're going to talk about implicit bias in homelessness. And it will also deal with it not just in homeless service systems, but also in affordable housing in general. So next slide. Okay, and just a reminder, I know you know who we are, but we are a statewide coalition of partners and advocates. And the bottom line is we just want people to have an affordable home to live in where they can thrive. Next slide. Okay, so when we talk about implicit bias, I am a visual person, and sometimes having a visual is really helpful for me, and I hope others. And I saw this, I was trained on this iceberg model a few years back, and it really resonated with me. And the whole idea of an iceberg, for those of you, going back to 7th grade geography class, is that there is what you see on top of the surface, but there is so much beneath the surface that is much bigger than what you could possibly see above it. So if we think about the tip of the iceberg being events, what happened recently in our minds? And so an example of this was an event in Louisville where there was a lot of coverage about how Louisville officials had started to clear homeless camps before Derby. Then they were kind of challenged on it. And then suddenly they said, no, we won't clear the homeless camps after all. So looking at that kind of as a one-off incident, you're like, okay, great. But if you look a little bit below the surface, you see that this is kind of a pattern of behavior over many years, especially with the construction of I-65 and the I-64 interchange and different places, overpasses, underpasses, where people experiencing homelessness would camp. This has been going on for several years now. And so another piece of media coverage was Louisville shoves homeless into the shadows, but offers no real solution. That was an opinion piece done in the Courier Journal. And then if you look below that, you're getting into the structure of the system at that point. In Louisville, and by the way, I use Louisville as an example because a lot of this happens very visibly. And while there are some decisions that are made behind closed doors, there's a lot of public attention on unsheltered homelessness. So it's just not trying to pick on Louisville. It's just a good example of what we're trying to demonstrate here. So there are a couple of pieces of the structure of the system. And one is that a few years back, Metro Council had actually passed a 21-day waiting period for people experiencing homelessness if their camps were to be swept, and that there had to be a good reason that the camps would be swept. It wasn't just because somebody didn't like it there. There had to be a public health reason or a safety reason or something like that. Another piece of the structure that has been happening is we've been in the middle of a pandemic, in case anyone forgot. And so local governments have been encouraged to use the Centers for Disease Control and Prevention guidance, which explicitly talks about homeless encampments, people experiencing unsheltered homelessness, and how if there are encampments, unless there is some prevailing reason why the camp should be moved, honestly, especially pre-vaccine, the CDC said just don't move them. Like, the more you move folks and the more you disperse them, the more this disease is going to spread. Another piece of the structure was, Louisville had conducted a housing needs assessment a few years back that said, that determined that actually Louisville is short about 31,000 affordable homes for extremely low income people in Jefferson County. Those are the folks that are going in and out of homelessness. So that's the larger housing structure. And then below that, that's when we start doing the real work, digging into the mental models. What assumptions, beliefs, and values do people hold about this system? Next slide. Okay, perfect. All right, so when we're talking about implicit bias and the mental models that we hold, where do we see it? We see it a lot in just the general public. in how people experiencing homelessness or housing insecurity are discussed. We see it a lot in the healthcare settings, how people are treated by providers and front level staff. I really probably should have put private housing market first because that is completely where we see it. And that is what drives a lot of housing insecurity. And then honestly, and this is something that those of you who are serving in homeless service organizations, this is something I want you all to take, just a moment to reflect on, and we will at the end, about, do we have some implicit bias going on at our service sites and how we deal with people? The other thing to know is that implicit bias really is just intertwined with other belief systems and institutions. If you're a systems thinker, like I am, if you ascribe to the concept of open and closed systems and systems influencing each other, you realize none of us live on an island. We are all influenced by each other institutionally and relationally. And so it is important to center our thoughts on the people that we serve. It's important to center those who are impacted, and it's also important to recognize the bias that is demonstrated in these other belief systems and institutions. For a very long time, I thought we as advocates could address housing insecurity, homelessness, the deep unfairness of our housing system by addressing class only. As I have grown and matured and learned, no, you can't do it without addressing systemic racism. You have to address both race and class. Again, I mentioned housing, and we will talk more about that, obviously. But also incarceration has really popped up over the last few years, but it's been a long time coming. Nationally, we know many people are incarcerated. They eventually come out, right? They're not incarcerated forever. And what happens when they come out with a felony on their record? How easy is it or not to obtain a new home to live in? And then if you have other systems that you think influence it, implicit bias and homelessness, feel free to put those in the chat. Next slide. Hey, Holly, I'm just checking to make sure you can still hear me.
Yeah, I can hear you.
Okay, cool. All right, next slide. Okay, I don't know if it's my internet connection, but I'm gonna go on.
I'm sorry.
No, you're fine, because I've been out of the house all day, and so I don't know if it's it just seems like it's a little bit delayed. So thanks for your all's patience on this.
So go to the next slide.
Yeah.
Okay.
Yeah, slide 5.
Do I need to go? You said slide 5. I'm sorry, I can't hear. Okay. Is this where you
It's
need me
okay.
to be?
No, the next one. The one that says general public.
So I'm on general public and it says social media, public meetings.
Yeah, okay, great. Then you're in the right place, and my computer is not, because it is, why not at this point today?
Yeah.
Again, thank you for your patience. All right, so we see when I'm talking about general public, we're talking about different outlets like social media, public meetings, your parents, so short media clips that go viral. And some of these things are real comments that I have heard over almost 20 years of doing this work. Some of them were pulled from a lovely Facebook group that conflated homelessness and panhandling in Lexington. And some of the really not accurate and hurtful things that have been said are some people choose to be homeless. If you give a homeless guy money, they will just use it on drugs and alcohol. If you don't address the root cause of why so-and-so became homeless, they'll just end up homeless again. People need a hand up, not a hand out. We want to help people who help themselves get a job. Some people just aren't ready for housing. And when viewed as kind of a one-off, that may seem reasonable here and there. But here's the thing, if you don't address the root cause of why so-and-so became homeless, they will just end up homeless again. Here's what actually, if you house someone, then you've ended their homelessness. Now, they may become homeless again. That is true. But in the meantime, have you actually housed them? Yes. Have you ended their homelessness? Yes. And if you house them first, then you can address all of these other issues that may or may not have contributed to their homelessness. We need to remember that the primary driver of homelessness is high housing costs, not individual pathologies. Next slide. Okay. In the general public, we see some perceptions, especially with discrimination and well-being amongst the homeless. This was a study that was done that was peer-reviewed, showing that there is evidence that when the stigmatized identity is viewed as to some extent controllable, so think unemployment, nobody wants to work anymore. People who are addicted to drugs, well, if they were just strong enough, they could end it. Or obesity, group-based discrimination has a much more harmful effect on well-being. And here's the thing, because the housing market, the housing system has worked for a majority of people, it's very much viewed as something that you achieve on your own with no help from anybody. And even though that isn't actually true, there are a lot of deep-packed, hidden policy choices that make the housing market the way it is. If someone's housing status is viewed as a choice, then if they are homeless, well, then clearly they haven't made the right decisions. And so therefore they're likely to face pretty legitimate forms of discrimination, pretty socially accepted forms. Next slide. This is what is very disturbing to me, that people without homes are perceived as not fully human. Your house status does not affect whether you are a human being or not. But when groups take over, when we have these implicit biases, it becomes more and more acceptable to discriminate against people experiencing homelessness. Next slide. Okay. In the healthcare realm, there was a study that was done in Alabama. That was a partnership between the University of South Alabama and the Housing First program, which actually hosts a free annual event at the local fairgrounds to connect the homeless with legal, medical, social, mental health, and housing services. So basically like a stand down event. It also allowed the coordination of health services for people experiencing homelessness with actual students from the College of Medicine, College of Allied Health, College of Nursing, so a multidisciplinary background. And there were three main themes that were identified. One was inherent bias or prejudice. One was individualized care. And the third was societal context of homelessness. Next slide. Because what they did was do a pre and post test survey. And they asked qualitative questions of the students who participated in the stand down event. Like, what did you learn about homelessness? Do you think it's important for students to have experience working with the homeless before graduation? Why or why not? And both the quantitative and qualitative findings suggested that a structured opportunity to provide health and wellness services might help students reflect on preconceived stereotypes and fears. And since people experiencing homelessness do interact in the healthcare system, the more we can reduce bias in that system, the better off we'll all be. Next slide. Okay. The housing market and the community at large. So some of the places we see it, we see implicit bias is in what we call source of income or voucher discrimination. And that's the box on the right. You see this in ads, like saying no Section 8, no HUD. And then it's just saying that somebody's voucher isn't as good as somebody else's 3 months of W-2s that they just had. Both have the ability to pay, and yet one is viewed as lesser than the other. Homeless status. So if somebody has been homeless in the past, they may be discriminated against by landlords who may ask, especially if they have any sort of application process. The third one is big. If you have an eviction on your record once, it is incredibly more difficult to find a place to rent. And when you do find a place to rent, you will get to pay more for the privilege of living in a place that is probably not of your choosing, not your most desired neighborhood, and is probably not safe or really habitable. And then the thing that makes me absolutely crazy is anti-homeless architecture. And you will see this, I mean, there are entire like blogs and Twitter accounts dedicated to this. But when we see benches that aren't actually comfortable to sit on, they really aren't comfortable to lie on. Or if you see spikes in the ground under a bridge, what people are trying, what local governments may be trying to do is discourage the ability of people experiencing homelessness to sleep overnight in a public space. Okay. Within the homeless service provision field, sometimes we will witness and we may even perpetrate homeless microaggressions. And the left-hand column, sorry, I'm on slide 11, just in case we're not there. The left-hand column talks about, you know, what I mentioned before, subhuman status, invisibility, other different mental models that we may have for folks, and how it manifests itself, especially when we are when we're not fully thinking, when we're using shortcuts, when we're tired, when we may be experiencing a little bit of burnout. We may think things like, well, they deserve their situation because they've done nothing but make bad choices. When we talk about invisibility, you know, are you seeing the people that you walk past? Are you seeing people who are unsheltered? when we think about aesthetically unappealing, these are folks who just aren't conforming to common standards of hygiene appearance. And a lot of it is just basic access to things like water and soap. People who don't know better may assume that somebody experiencing homelessness may be dangerous, that they may have a criminal status that they don't actually have. A lot of people do carry knives for self-defense instead of like actively going out to try to commit a crime. One thing that I run into a lot in the public policy field with in working with elected officials, we did a presentation yesterday, just kidding, last week with the Kentucky League of Cities. And there are a lot of questions about mental illness and substance abuse. Well, let me remind you that not everybody experiencing homelessness experiences severe mental illness. Not everybody who is homeless is using substances, legal or otherwise. If they are more likely to be successful in addressing those issues once they are housed, as to when they are living in, opposed to when they are living in a shelter or on the street. And then there are a lot of mental models just around laziness and intellectual inferiority. And I think a lot of that is masking, if I am smart enough and I make all the good decisions, I will be okay. It's when you start making bad decisions, poor choices, that's when you experience homelessness. And that's not always the case. Next slide. Okay. So we have some guidance from the National Alliance to End Homelessness and the Connecticut Coalition to End Homelessness. And just recognizing how implicit bias in service delivery can have a major impact. So how does it manifest itself? Which services are offered? Like, does everybody get the same option of choices in terms of the assessments that they can take or the properties that they're shown? Where services are offered? Are you willing to go to somebody's house? If say they are white or they have a mobility issue, but you're not willing to go to somebody whom you perceive to not have a mobility issue. That goes to, how services are offered. Are you willing to be flexible and connect with people where they are? Or do you place extra demands on certain folks? Who is delivering the services matters. People who have an idea of what it is like to be impacted by housing insecurity are more likely to be empathetic and understanding. And then also, quite frankly, racial demographics matter in terms of who is delivering the services and who is managing the direct service providers. Many of us are at nonprofit organizations. The nonprofit sector as a whole is generally whiter than the population at large. And that has an impact when you are serving people who are more likely to be Black in certain settings, like in the homeless management information system. We know that generally speaking, people who are Black are more highly represented in that system than they are in the general population. So like in HHCK's programs, 11% of the folks who are in our permanent supportive housing programs identify as Black Kentuckians, whereas 8% of Kentuckians identify as Black. So just keeping that in mind, representation matters. Next slide. So I would offer, as we get to the end, some key takeaways that may be helpful for you as you go through your service year. And sorry about that, Carla. It's I think it's my internet. Okay. So I would advise you all to question and challenge your own biases, to always treat people with dignity, to listen to people impacted by housing insecurity and homelessness. I've got a couple of links in that slide, both reading and video. I would participate in community planning meetings where housing may come up, or maybe you think housing should come up. And if at some point you become a landlord yourself, I would highly encourage you to rent to people with vouchers. And I would also, once you, finish your term of service and you go on with your successful and illustrious career, cast a wide net when hiring. Make sure that you're not screening people out that could be really, really good for your organization and the clientele that you serve. And then lastly, I would just advise, when you have somebody in a bad situation and you're like, God, how did they end up there? Interrogate institutions, not always individuals. So how are institutions operating so that people do have fewer choices? This presentation has focused a lot on homelessness, and that was by design because it's very apparent there. But in the private housing market, it has become clearer and clearer. There is more and more evidence now about the appraisal gap in homeownership. When homeowners who are trying to sell their homes are perceived as Black, that their homes will get appraised for a lesser value. That if they take down the pictures of themselves on the mantle, and if the house can be perceived as a white-owned house, then the appraisal will be more. And it's that kind of stuff that is so insidious and has really resulted in a housing market and a housing system that doesn't work for more people than it does work for. Okay. I'm going to check the chat real briefly. And yes, Frameworks Institute is very valuable. Holly, if you can include those in the link when you send out the chat or when you send out the PowerPoint, and all of the links in the PowerPoint are live. So, all right. Does anybody have any questions before I turn it back to Holly? Okay, well, thanks again for your patience, you all. Yay for the bipartisan infrastructure bill that just passed. Maybe we can have good internet here in Frankfurt. With that, I'll turn it back to you, Holly.
Thank you, Adrian. So you don't have any problem with me sharing the actual PowerPoint?
No, go for it. This
Okay.
presentation was adapted for one that I did for Community Action Council in Lexington a few months back, or maybe back in the spring. So yeah, just sent out the whole thing.
Great. Thank you so much. And I hope you're feeling good. So the last couple things before we wrap up, I just want to say, so for this hour, log it under Homes for All training or AmeriCorps training on your timesheets. We will send out the recording to everyone, and I will share the link that Caitlin posted from Frameworks in the comments or in the chat, and I will share the PowerPoint so that the other links that are in Adrian's training or on the slides, you guys will have access to them. So you'll just be able to click the hyperlinks and go straight to, the readings or the videos and stuff. So I just wanted to follow up with that. I know some of you guys, I'll have a more clear answer on how we are going to observe the like the winter holiday, since Christmas is on a weekend. So I will get that cleared up with everyone so we can have a better idea. If you have a a situation, if you had a specific situation, just send me a follow-up email so that I can look at it. It's just easier to kind of look at it in an email than try to talk about it over a group training. So we'll get that taken care of as well. Be thinking about MLK Day. Again, I'll have your small groups to you with the other members in your group's contact information by the end of this week. And let's see, I just had something else on my mind that I was talking about and now I forgot it, but it's all been talked about at the beginning of this training and it's recorded. This will be on our YouTube page as well, so you can refer to it at any time. You'll have access to the PowerPoint, so you'll be able to look at it whenever you need to. I just want to say thank you again for, taking some time out in the afternoon for us to get together as a program, and we really appreciate what you're doing across the state. And for those of you that I haven't done a site visit with yet, don't worry. We'll get those scheduled, and I'll be seeing everyone soon. You guys enjoy the rest of your afternoon.